Thank you. I'm going to propose that diseases are becoming increasingly uncommon. That's not because we're curing the human condition, but it's because we're understanding that single illnesses actually are made up of very complex subtypes, and we understand that a single diagnosis may have many underlying forms. I'm an expert in an eye disease called uveitis. It's the second most common cause of blindness in the working age group. It's also made up of more than 20 different subtypes, and we've known about these subtypes for many decades. So in my field, people are already used to dealing with complex disease, and we're already used to dealing with the challenges of improving outcomes for patients with rare diseases. The reason it's a challenge is that to improve healthcare, the standard paradigm is to conduct a clinical trial, to compare a new treatment to what is the current standard, to see if the new treatment is better. But in rare diseases, that's very difficult. You need large numbers of patients to do that comparison. And when you only have 5 or 10 patients in an individual hospital with a condition, how do you go about that? The answer, clearly, is to collaborate, to work across institutions. But historically, the medical profession hasn't really been structured like that. Medical school and medical training selects out competitive individuals. They're measured by personal success. We're not always the best team players. Consequently, we haven't always made as rapid progress as we would like in understanding uncommon illnesses. What I'd like to share with you is an example from my field in eye and vision research, which is trying to forge a new way to bring people together and to really deliver advances for patients with uncommon eye disease. About this time last year, we were very fortunate to be supported by the United Kingdom's National Institute for Health Research in establishing a formal partnership between 2 preeminent eye hospitals, one here in Bristol and one in London, Moorfields Eye Hospital. And through that partnership, we've achieved a true strategic alliance, more than just a contractual collaboration. We share people and we share resources. And that unification has delivered a merger of 2 institutions which together cover a population of up to 20 million patients with eye disease, which drain into these 2 specialised institutions for specialist healthcare. In a short period of time, this has revolutionised our opportunities to conduct research and arrive at answers faster than we were previously able. 6 years ago, in Bristol, we set about conducting a clinical trial into one of our uncommon eye diseases. It took us 4 years to recruit less than 100 individuals. At the same time, there were patients with that eye disease going into different hospitals around the country. And so it seems natural, if we can bring these institutions together, we're going to achieve medical advance more rapidly. This idea is catching on. Today is about Bristol Health Partners, the launch of a joined-up approach. We've tried to take it a step further and forged a consortium with the National Eye Institute in the United States, in Washington, where TEDMED is based. That consortium, again, is more than the traditional contractual arrangements that have existed for clinical trials. It's a meeting of minds, it's a sharing of people, it's bringing information technology of the sort we've heard about together. That strategic alliance is for the first time bringing 2 continents together to deliver a combined program of work which promises to deliver a quantum leap in our knowledge for uncommon illnesses. Now, I believe that applies to everybody in this room. I started by saying that all diseases are becoming rare. As science improves our understanding of the biology of illness, and we realize that the cancer I have is not the same as the cancer you have, even though it has the same label, we're going to increasingly find ourselves in this dilemma of trying to match patients with the same biological condition across countries and across international boundaries to conduct research. What I propose to you is that the medical profession needs some help in getting there. Today is a wonderful example of partnership. And we've heard from Peter Matheson earlier that the institutions in Bristol are coming together to forge improvement. But I believe, because of the structural and cultural norms within the medical profession, we need help from the public. You need to cajole us, and you need to drive change to join us together if you're impatient about having improvements to your health. With your support, I think we have a very exciting joined-up future together. Thank you very much.